Luisa, well, it wouldn't be news in itself, but a significant shift in trend. Many countries are beginning to awaken and seriously question what truly lies behind the denial of tobacco harm reduction. This change is not coming from the bureaucrats, who are widely influenced by certain powerful lobbies. We all know that to be true. In fact, it is these very bureaucrats who are actively impeding this change. It comes from parliamentarians in various countries, many of whom are increasingly taking a stand. For example, in Spain, our Minister of Health and her cronies introduced a new decree prohibiting flavors. The nicotine dose in pouches is lowered to 0.99 milligrams. It's a de facto ban on the safest products, which clearly benefits combustible tobacco. When this law was presented in Europe, surprisingly, there was a historic complaint from many countries of the Union. Complaining and opposing this regulation, right? It even nearly resulted in a diplomatic conflict with Sweden, because the Swedish government sent a formal letter of complaint to our Minister of Foreign Affairs. And that's not the only sign of change I've witnessed. Also, very positively, I had the opportunity to be in Geneva during the development of COP11. I witnessed, astonished, how they tried to boycott the anti-prohibitionist stance that European governments had agreed upon. But I also witnessed how many small but very brave countries are starting to step forward and beginning to ask for harm reduction from smoking to be discussed within the COP, right? These countries were accused, admonished, and even ridiculed at COP11, but curiously, their numbers are growing more and more. In Panama, 4 or 3 years ago, only a few began, and this year there have been significantly more, right? Only a few years ago, it was utterly inconceivable that any nation would even dare to utter the phrase tobacco harm reduction at the COP. I truly hope that this signifies that things are indeed beginning to change.
I think I have a great UK example, and the recent news that the prevalence of e-cigarette use has overtaken smoking prevalence, which is fantastic for the UK, for the population as a whole and for population health. I mean, we've been seeing a steady decline in the number of people smoking in the UK over many years. And it's great, a great example, I think, that a permissive government, a permissive regulatory structure, a great academic science base has really supported tobacco harm reduction in the UK, and I think it's paying dividends in the numbers that we are seeing. And as I say, the record numbers of smokers who are switching to something that's way less harmful to their health.
As I was saying, despite countries like Mexico, India, Australia, or my own country, Spain, allowing themselves to be corrupted and adopting senseless prohibitionist stances that are already costing thousands of lives, I believe a clear shift in trend is starting to be seen, especially in European countries, right? And my wish is that the brave parliamentarians of these countries, who have truly informed themselves about tobacco harm reduction, become even braver, that all the corruption and interest behind the denialism of harm reduction are finally exposed. And I wish this scandal, for it can only be called a scandal, finally leads to all countries adopting coherent, risk-proportionate regulations that save lives instead of taking them. My greatest wish for my country is that Minister Mónica García's intended prohibitionist law never sees the light of day, because it would mean the loss of thousands of lives that could have been saved if a coherent law based on scientific evidence were adopted, instead of one based on ideology and interests, as always.
I think we need to have a bit more compassion by those who are affected by bad regulation and by banning of novel tobacco and nicotine products, and these are the smokers who are suffering from heart disease, from lung disease, from cancer. And I think we're forgetting about those people, and those people need our support. Traditional nicotine replacement therapy isn't helping them. Pharmacotherapy isn't helping them. Behavioral therapy isn't helping them, and they need something else to help them to stop smoking. So I think we have to be a bit more compassionate and really think about the adult smoker, remembering, of course, that most smokers have comorbidities such as mental health problems. They have low socioeconomic status. They're increasingly older people in the population. So I think having compassion for those people, let's really target the adult smokers and help them to use novel nicotine products to get them away from cigarette smoking.